Welcome to State of Reform's virtual leadership series with some of healthcare's most thoughtful leaders. And now, the host of State of Reform, DJ Wilson.
This is like our event, a multi-silo conversation, bringing together folks at this intersection of public policy and market activity in this conversation about the future of Arizona healthcare. We'll talk a little bit about the future of American healthcare, but particularly the future of Arizona healthcare. And so to be with us, we have Senator Vince Leach, the Vice Chair of the Senate Appropriations Committee, Pam Cahaley, the CEO of Blue Cross Blue Shield of Arizona, Anne-Marie Alamadine, the CEO of ASHA, or the Arizona Hospital and Healthcare, good Lord, I always screw that up. Healthcare Association, and Abner Mason, the CEO of Consejo Sano. I appreciate all of you making time to be with us. Pam, let me just sort of jump in with you, and a common thread amongst our attendees, those in the room, those that come back and watch this, is that they are all leaders in different ways in multiple silos here in the healthcare space, but of course they're all navigating this time of COVID. So let me ask you how you have led Blue Cross Blue Shield through this time of COVID, how you as a CEO has sort of gotten your hands around leading through this tumultuous period.
Thank you, DJ. It's a great question. I think everybody has had to change just the way we do everything as a result of COVID, and leadership is certainly one of them. And I think it's probably made all of us better leaders because we've been forced to really pay attention to how important that is, getting through this really challenging time. I think that I've certainly had to change my personal leadership skills around how I work within my own organization. I think that, for me, the biggest change that I've seen in leadership as a result of COVID is how the healthcare ecosystem leadership has come together. It's actually just it's a beautiful thing, and I hope it continues after COVID. But when we recognize that the pandemic was a serious situation, that was probably, I think, maybe late February, we started to understand the magnitude of the situation and the stress that it would place on our medical system. And so at that point, the health sector came together in Arizona in a way I don't think it ever has in the history of Arizona. The CEOs of all of the major health systems, the CEOs of the not-for-profit community health organizations, the CEOs of insurance companies started meeting on a regular basis and working on the challenge of COVID. And the objective of the big goal that we all had together was, how do we save lives? How do we mitigate the spread so we don't risk losing many of our citizens? And so the group working together had some pretty astounding accomplishments. We worked with the state in coordinating public health initiatives. We had a really good Mask Up AZ campaign that hopefully everybody has seen. Lots of different versions of it, but a very, very strong PR campaign around the importance of masking. We worked together to remove administrative barriers that kind of got in the way of delivering care. So for instance, we took out the pre-authorization requirements for post-acute transfers. And all the insurance companies did that for all of the hospitals. So in order to facilitate the throughput, particularly when we were hitting our maximum capacity really close in early July. And we were so nervous that we were going to go over capacity. And so we put in this process that allowed us to move people, once they were ready to be moved, to post-acute systems quickly to free up hospital beds for new patients that came in. So for me, I've been so amazed at how the leadership has come together and worked together side by side, shoulder to shoulder, to address this pandemic. And it's unusual because we all know there is this just natural and unfortunate tension that's existed for decades between the medical delivery system and insurance companies. And it's around unit cost and all the, the bureaucracy that insurance companies have in place. And it's so nice to kind of move above and beyond that and really work together on a common goal. And so I'm hoping we all learn from that and that we take that beyond COVID.
Anne Marie, I wonder if you share those same sentiments and not only about collaboration in COVID between plans and providers, but also within the hospital community, the urban and the rural and the very large and the not so large. How has collaboration within the provider community looked during this time of COVID?
I think there's been, to echo what Pam is saying, tremendous collaboration between health plans and hospitals, between urban and rural hospitals. We are really, I think, acting as we should during a public health emergency, and that's we're acting as a health system. We're not acting in our own particular silos. We're a healthcare system, and we have a mission, and we're focused on public health measures, interventions, saving lives, keeping people healthy, and we're all aligned around that goal. And so all of, I think, the barriers that we've had for, decades begin to fall away, and you can just really blast through some of those barriers. And it really comes down to relationships of bringing leaders together and being focused on solving a problem. And I think we've been doing that. And we certainly have a lot more work to do. But we can take this model and apply it to, our post-COVID healthcare system when we talk about value-based care and everything that we also need to sort of blast through to get through. If we can focus on patients, that's what we need to focus on. We need to focus on the healthcare delivery system and how we're making, high quality, affordable care accessible to as many people as we can. So it's been productive, certainly, and there's a lot more work to do, but I do think we have a new model kind of going forward as to how we can solve whatever problems we might have in the future.
So, Senator, we may not have, if we were writing the script about how to navigate a pandemic, we might not want to put it in the middle of a general election, but that was the hand we were dealt. How, as a citizen legislator, do you try to get your hands around making good policy, good fiscal policy, supporting, the healthcare sector, particularly in the Medicaid community or the Medicaid sector where the state is such a prominent force? How do you, as a citizen legislator, try to make heads or tails about this pandemic vis-a-vis the good policy and maybe separating out that from the real world politics?
Well, first of all, DJ, thank you for inviting me. The quick answer to your question is you pray. And you pray a lot, but actually what happened as we look back and as someone who's been involved in budgets now, I'm going into my 7th budget. We spend a lot of time. We started working on the upcoming year's budget, which will go into effect on 7/1 of 21. We've started working on that. We had pretty well put our budget together for the year that we're in. I remember walking into a very impromptu meeting in the President Fan's office, along with the chair of appropriations. And that was the same day that that the Big Ten tournament, which are already basketball tournament that already started, was canceled. NCAA decided that they were not going to have any basketball tournament. And within 24 hours, the Major League Baseball said two things. They weren't going to have Major League spring training, and second of all, that directly affects Arizona so heavily is we're not going to do Major League Baseball spring training in Arizona. It came almost simultaneously to the three of us that the budget that was going to see $1 billion surplus, I hate to call it a surplus, but $1 billion over budget. Within 24 hours, we went from $1 billion in excess over budget to $1 billion shortfall, literally. And we came back on a Monday, and by Monday night, this was on a Thursday when we found out all this. Then the following Monday, we had a what is now become known as a skinny budget. And we did something that was unheard of in the legislature. We had a bipartisan skinny budget put together within 4 days, and the Senate voted on it and passed it out Senate to the House on Thursday evening. That was being part of that, to see all members of the majority caucus and then the leadership of the party across the aisle, the Democrats, come together and decide that, yes, we are in a very unique position, that we don't know where this is going to go. We had started talking about it late January in meetings. In February, it became more obvious that we were probably going to have to recess earlier or sine die earlier than planned. So there were a lot of things going on in the air, but the one thing that we constitutionally have to do is pass a balanced budget. And we were able to do that not only with the coordination of our caucus, but with the coordination and a lot of help from Democrats to put a budget together, to get it passed. I think the House passed it the following Monday or Tuesday. And that was just, as the previous two speakers said, it tore apart, it tore down all the walls, all the sheets, all the smoke and mirrors, and said, we've got a serious problem on our hands. We've got limited time to deal with it. Let's deal with it as best we can. And fortunately, for the taxpayers of the state, we had done some things before by cutting our debt, building up a rainy day fund. So we're not in a terrible budget position. But we were able to get someplace, keep things going, put some money into some places, and we were able to pass, and I know that you mentioned access, we were able to pass through some increases within that particular area, and we got that in the skinny budget. So it was collaboration, and could that ever be replicated in a very partisan situation again? I don't know. But I know that we did it once, and I'm sure we can do it again.
Yeah. Abner, before I throw a question your way, give us a rundown first of what Consejo Sano does. And I made this error earlier today, Abner. Even though we're 9 months into this, I still forgot to take myself off mute. You're still on mute too, sir. You got to take yourself off mute.
There we go.
There you go.
Okay. Yep, thanks for that. So Consejo Sano is a patient engagement and patient navigation company. We work with health plans, Medicaid, Medicare Advantage, commercial and exchange, and also providers. We help them to build a more trusted relationship with their patients and members. Our healthcare system is just not well equipped to serve the country that we've become. We're much more multicultural now. So is Arizona. Arizona's on the way to becoming a majority minority state. California, where I am, is already a majority minority state. But our healthcare system still engages in this sort of old way of sort of one type of message, usually written for an English speaker, translated, but usually not well. And when you do that, you send sort of a one-size-fits-all message. What you're saying to the patient or the member is who you are doesn't matter. Your journey that brought you here doesn't matter. The things you care about and hope for and fear, your willingness to engage, none of that matters because we're going to treat you like we treat everybody else. And what we found is that that doesn't build trust, and our healthcare system really needs trust now more than ever. And in fact, COVID has really taught us and continues to teach us just the importance of trust with patients and members. So what Consejo Sano is doing is using technology and data to understand who people are at a deeper cultural level and then engage with them in that way. And we're getting great results because we're able to build that trust and to have an engagement with the member or the patient that's two-way, and that helps, then allows us to navigate them into healthcare at the right time and at the right place.
So what have you seen in your data in Arizona, in other states in the country, about the exacerbation of health inequities, particularly racial disparities, in this time of COVID? We know that is one of the storylines out of this pandemic, that it hits people of color. This disease has hit people of color harder than Caucasian folks. How are you seeing that kind of play out in your data?
It's a moment of reckoning of sorts. I think we all know that health disparities, it's not as though they didn't exist before COVID, but what COVID has done is it has shined a bright light on those disparities, and it's shown us that our healthcare system just isn't working well for everyone who calls this country home. And it's shown that light in such a bright way that it's kind of hard to ignore it. So one, on the negative side, the disparate impact of COVID on communities of color. I won't share all the data, you know it. African Americans are about 2.5, 3 times more likely to die. Latinos have much higher infection rates than their white counterparts. Other vulnerable groups, American Indians, Navajo folks, I know very much the case in Arizona. The data is there that this disease has had, it is not an equalizer. It is not. It treats people, different groups of people differently based on the circumstances that they find themselves in. And so the question for us is, what are we going to do about that? I mean, I don't think there's anybody who disagrees that COVID has had a disparate impact. What are we going to do about it now? I think is the big question. And what we're finding at Consejo Sano is that a key thing that we need to do is to build trust. And that's so important for 2 reasons. One, more generally going forward with our healthcare system, given the history and given what we've learned now, we need to do a better job of engaging patients and members and getting them involved in their care and trusting the healthcare system because they don't now. And given what they've seen with COVID, you can see why their trust antennas are up and they're reluctant to trust. The other reason why trust is so important now is that we're about to embark on a huge initiative. This vaccine rollout, we all want the pandemic to end. It's had a worse impact on communities of color. But if you look at survey after survey, more than half of African Americans are unwilling to take the vaccine. Almost 40% of Latinos are unwilling to take the vaccine because of trust. And so I think the healthcare community, those of us on this panel, the folks in this audience, we need to be, I think, doing some self-reflection too. I'm doing it. And I'm suggesting we all need to self-reflect and say to ourselves, what am I willing to do? What am I going to do in 2021 that's different than what I did in 2020 and before because of what I've learned in 2020? I am hopeful that folks have learned a whole lot. I know I have. And I know that we need to do things differently. We need to be better and do better. And it's not just words. What plan do you have for 2021? Are you going to fund that plan? And are you going to see that plan through to implementation? And that means general health care, but it really also means this vaccine. If we don't get this right over the next 30, 60, 90, for 4 or 5 months, it will be such a lost opportunity for our whole country because we will not get beyond this pandemic. So that's what we're learning. Trust is important. We've got to do things differently because the trust isn't there. We need to be honest about it. We need to self-reflect and not point the finger and say, what are you doing? But we need to be saying, what am I going to do? With what I've got control of, what am I going to do? And that's what we're trying to do at Consejo Sano. And I'd really encourage all of us, all the listeners, to take action.
So Pam, what about this question that is super hard and there's no great answer for, but this question of what have we learned in 2020 and COVID that we can employ in 2021 related to cultural competency, related to building trust with patients, between the sector and patients? Talked earlier, obviously, about trust and relationships between providers and plans, but what are your thoughts on this question of how the COVID experience informs cultural competency and engagement in 2021?
Yeah, I was very interested in what Abner was saying because I'm struggling now with trying to understand how we can overcome the trust barriers relative to the vaccine. And the African American community specifically, only 14% trust that the vaccine is safe and works. And that's a really scary thing because if we don't embrace this solution, we're going to continue as a nation to struggle. So we're very focused on it. I don't have an answer. I wish there was a silver bullet. I do know that we're also very focused on tailoring messages to different populations and not treating everybody as one kind of standard group. But I don't think we've figured it out yet. I don't think that we have figured out how we can address these disparities. So I don't have an answer. I can tell you that's such I'm so angry at you for asking me that question because I don't have an answer.
I don't have a good answer either.
I wish I did, but I'll tell you, we're very focused on communications. We're very focused on following through on our commitments to build that trust. We understand how important trust is. We measure it with our population on a regular basis with surveys. We measure our Net Promoter Score. And one thing that we have seen through the COVID pandemic is our Net Promoter Score and insurance companies' Net Promoter Score overall have gone up significantly. And that is because insurance companies, many of them, really amped up the communication and reach outs to their membership because of COVID, and are viewed as an entity that really is caring about their well-being. And I think insurance companies in general have learned a lot about how to communicate with their membership because of COVID. And so we're seeing the benefits of that, and we'll continue those learnings. But we're just on the beginnings of really trying to understand how to how to tailor communications and services to different demographics, and how to support getting the services that certain demographics are lacking, getting those to those communities.
Yeah, I know it's a tough question. I appreciate you leaning into the uncertainty. I certainly don't have an answer myself. Anne Marie, I'd sort of ask you the same thing. How do you think that your members in different geographies in the state, rural and urban, how are they trying to stay close to their community and better understand and support their community as they go through these challenges? The loss of hips and knees, elective surgeries that damages the P&L, damages the financial stability of some of the hospitals. But their success is going to be connected to their relationship with the community and the trust that the community has in their hospitals. Give us a sense of how your members are trying to navigate this trust question with their communities.
Yeah, I think it's really inherent in the pandemic. I think hospitals have been, turned to as this, crucial source of services. And that's what hospitals do, taking care of patients in their community. So I think the tie between hospitals and communities have really been strengthened. I can't think of a time in recent history where hospitals have been so dependent upon the behaviors of our community for our safety. That those messages of when you wear a mask, you're protecting your healthcare heroes. We are so dependent upon the community and everybody stepping up to do their part. So I feel like that interrelationship that is so obvious during the pandemic, it has certainly strengthened what already existed, but it has really made it that much more obvious. Never before in my community, our physicians and nurses, are looking to us and saying, you need to help us because we can't do this alone. If this goes unmitigated, it will overwhelm our healthcare system. And we heard that certainly throughout a couple of sessions today. So it's just that important. And I think all the listeners, to really take that to heart. We have learned a lot of things in the pandemic, and one of them is public health interventions work. And so how can we double down right now to really flatten the curve, because we are at a dangerous level right now.
So Senator, I had somebody convey this to me here recently. I'll share it with you and our audience here and see what you make of it, which is this person said, a year or two or three ago, if you were to walk the halls of the legislature, you'd hear that health plans are out of touch, the hospitals are expensive, and pharma is, they're all greedy. But now health plans are doing all the things that you'd want them to do, and hospitals are on the front lines wearing face masks, 14-hour shifts or 12-hour shifts. And we're all keeping our fingers crossed that pharma is going to come through with a great vaccine, which looks like it may have emergency approval next week. How has this pandemic changed the politics of health policy and some of that advocacy, some of that infighting that happens in the legislature that you have to sort of bear the brunt of? How has this changed some of those conversations with advocates that you're hearing about in the legislative context? You're on mute still, sir. Sorry about that.
I can tell you that within the last 3 weeks, not counting Thanksgiving week, we've met with Child Protective Services. We've met with Department of Health, Department of Economic Security, all in an effort. That's part of our ongoing steps that we go through in putting a base budget together. Never have I, in the previous years up to this year, been involved with discussions on. I did not know that we had warehouses. I knew that we had ventilators, but I didn't know that how many we had. It was never a discussion point before. It was never a discussion point about shelf life of certain products that are brought in to deal with COVID-19. It was never a discussion point about, it was known, but never a discussion point, how valuable the education community is in observing and identifying potential child abuse problems. It was never talked about or really in base budget negotiations about, yes, we passed bills and we've done studies on causes of suicide, but I think COVID, unfortunately, has put a fine point on that. And so I think the areas that we might have squabbled over $1 here or a dollar there in the budget negotiation process, it has now been elevated, if that is the correct word, to infrastructure, certainly to public safety, to education, and obviously to the other thing that we do, and that's our prisons. So what I'm saying in a nutshell is that your budget committee, and I can speak for the Senate, can't speak for the House, has brought a fine point that those are second and third level questions that probably, because it wasn't of a pandemic nature, never rose to the top in a discussion item. The agency would come in, ask for X number of dollars. It would be reviewed by the executive, by the House and the Senate, and it would be passed. I think now I can, as I said, I can speak for the Senate budget people, and we're going to the second and third level because not only are insurance companies talking to us, not only are farmers. I was just on a discussion yesterday on a panel where somebody from Pharma was talking about the shots that will be coming out shortly and the review process. But it has put a fine point on it, so the budget people, which necessarily aren't health people. I'm a numbers guy. I got pages and pages of numbers here that we just don't go into. We look at a budget, we say, this is needed, this is needed, this is needed. We need to take care of the DD community. We need to take care of this. How much money in the whole pot of things can we allocate and still take care of higher education, incarceration, and the medical? Those are the highest expense items for the state, if you will. I think it's forced us in a good way to ask and learn about, first of all, and then be able to ask the second and third level question. I'll tell you who it's really made happy, and that's our staffers that have had worked in healthcare for years and years and years, particularly in the Senate. And now this is elevated to something where they're able to bring their expertise, and it's needed. It's needed. So hope that sheds a little light on it.
Anne Marie, I want you, if you don't mind, to take this question from Michael Goldberg. He asks about the potential for change and whether there will be a marked difference in the relationship between Arizona and its federal partners because of the change in administration, because of the presidential results, and maybe because of the gentle shift increasingly to purple in Arizona with the election of now Senator Mark Kelly. Do you see, and I should say contextually, the submission of an 1115 waiver renewal here this month by Axis, do you see a significant shift to Mike's question in the DC, the federal engagement by the state of Arizona?
Yeah, I think one of the most important things is that, during the Trump administration, we saw a weakening of the Affordable Care Act, attempt at repeal and replace. But then if it wasn't able to be accomplished legislatively, there was administrative sort of weakening of the Affordable Care Act. So much so that it's pending at the Supreme Court in terms of the U.S. Supreme Court in terms of its constitutionality, with the Trump administration not defending the constitutionality. So I think we'll see a definite pivot to strengthening the Affordable Care Act, to increasing marketplace and competition through the exchanges, going more towards value-based care, just taking the reforms that were attempted and done through the Affordable Care Act, and hopefully strengthening and expanding and correcting what needs to be corrected. The Affordable Care Act is by no means perfect legislation. There's many improvements that need to be done, but I think it really has the groundwork of important principles, and that is access to affordable healthcare, that we need to have affordable healthcare options for Americans. So I look forward to that strengthening.
So Pam, building on Anne-Marie's comments there, Jim Hammond asked this question of the Hertel report. Says he notes the continued lack of providers in the primary care and behavioral health care space, just a function of our system. He says, and that not having people covered during a pandemic is a weakness. Have we as a country now arrived at a place where universal coverage or universal enrollment is a goal? And if not, how close do you think we are to that becoming a consensus view?
Yeah, and Jim probably knows this answer better than I, but I would say that it probably depends on what happens in Georgia. First of all, if we've got the Georgia Senate race coming up, and if the Republicans win, then we'll maintain a split Congress. If Democrats win in Georgia, we don't have a split Congress. And I think if we don't have a split Congress, there is an opportunity for Biden to push through some sort of public option, and that's as close, I think, as the United States is going to get to universal health care. But he would not be able to get that done if we have a split Congress. But if we do, I think he'll push for that. I have grave concerns about that approach. I'm all for universal coverage. The public option is a government-run option that people liken it to Medicare. And the theory is that the public option would be more affordable because, number one, there would be no profit margin, and the insurance companies wouldn't be making a profit. It would be run by the state, by the government. And I have one word to say about that, and that's just a reminder about the co-ops. So that was a theory with the co-ops as well, with the exchange, and the co-ops were certainly a disaster. And the other theory around affordability is that the public option would contract directly with providers, and they would set pricing in the same fashion as Medicare. And here the flaw is that the commercial insurance services subsidize Medicare services. Providers don't make money on Medicare. So this would be a disaster for our medical delivery system from a financial perspective. So I think, there's a chance that we can get closer to universal coverage. I think the other thing Biden would do if he did not have a split Congress would be expand Medicaid in those states that had not expanded it. There's about 5 million people there that would be eligible for Medicaid if that expansion increases. And then the other thing I think that would get us closer to universal coverage that Biden could impact if he doesn't have a split Congress is what Anne-Marie said, and that is increasing subsidies on the exchange, increasing enrollment in the exchange, making it more financially easy to access coverage through the exchange. So I don't see it happening soon. I see we'll chip away at it, and again, it'll depend on Georgia, of all places.
All places indeed. Let me just ask you sort of generally, Pam, this question about this moment that we find ourselves in. Do you think as you're trying to, work with your executive team to chart a course for Blue Cross Blue Shield and working with your stakeholders in the governor's office and legislators, do you feel like this is a time where the state of Arizona should be ambitious and innovative and bold? Or is this a time to wait to let the feds kind of figure out what they're going to do? Or maybe this is, a continued incrementalist march, any of those could be good and reasonable strategies. I'm wondering where you think the right play is for the state of Arizona right now in terms of how to think about reform in the next few years.
Yeah, I think, first of all, healthcare is local, and it's different here than it is in California, than it is in New York. It's different. And so I think state solutions are generally more appropriate. However, there is a place for federal solutions on a broader scale. So for instance, interoperability. I always have trouble with that word. We really need to, it's going to be painful to implement that. And if states do it on their own, then you have different standards and you don't have the right communication. So those types of things need to be tackled at the federal level. But in terms of delivery on the ground, I think the state is in the best position to drive what makes sense for that population, and I also think that the system itself, the health sector system, can achieve a whole lot. I think we've learned a lot. I think we can achieve a whole lot without regulation at the state or federal level. We've learned how to collaborate in a different way. Providers are very much more open now to value-based arrangements, particularly with the impact to cash flow that a volume structure created. If we had more situations like in California where they've got providers on capitation, which is just a fee every month for the patients that they have, we would not have the same financial crisis we've got now with the delivery system. So I think there's going to be much more openness to that type of volume or value-based care. So I think we as a health community can do a lot of the lift, and I think we're ready and we're primed to do that. I think we need a little help from federal government on those bigger issues, and then everything else at the state level. A really good example is telehealth. That shouldn't be regulated at the federal level. It should be regulated here, and we need to look at that. We saw huge increases in telehealth with COVID, and we don't want to lose that. And so we need to craft legislation that enables that to continue in a way that reduces overall costs and increases quality, increases overall medical cost and decreases cost and increases quality. Yeah. So that's something that I think the state has a role in, but I think it's a combination of all of those three.
So Abner, I'm self-evidently a white guy. I do not have the lived experience that many people at the safety net have. I just I'm oblivious, and I don't know what I don't know. What am I missing in this conversation? What am I missing in terms of bringing to the table by not having a lived experience as a person of color, as a woman, as somebody who really is suffering more acutely in this COVID pandemic? What should I know that I have not infused into this conversation?
That's a good question. I think first, let me just say I want to just thank Pam. It warms my heart to hear a health plan leader who is thinking about building trust with African Americans and actually has statistics. That means she's thought about it, and so I just want to thank you for that. And I think that's a part of the answer to your question, DJ. We've got to make a commitment to ourselves that everybody matters, and that it's not okay to leave anybody out. And I think we need to figure out who we're leaving out, because we know we're leaving people out, but we don't have metrics around that. So to answer your question, I think some of the things we can learn from COVID is we need to do a much better job of collecting data. Most plans across the country, health plans, and I'll just use them because they're such an important part of the healthcare system, they don't collect race, ethnicity, and language, real data. And that's just the beginning, because if you look at a person who speaks Spanish and they live in South Florida, and a person who speaks Spanish and they live in Southern California, their life experience is completely different. The Spanish they speak is different. So just knowing that they're Latino, they speak Spanish isn't enough. We need to treat people like who they are matters. And the beginning of that is collecting data. So one thing, we need to definitely collect data in a better way than we do. And I think there is a national role for that and a state role. And then second, I think we need to, and I'm glad Pam mentioned this, we need to look at regulations that get in the way of us being able to connect everybody to healthcare. So for instance, telemedicine and telehealth is an example. It's crazy that it took a pandemic to get regulators to let people use telehealth and telemedicine. I mean, think about that. It's like 20 years old. And it took a pandemic for the regulators to get out of the way and say, okay, it's an emergency. You can actually talk to your doctor in the way that you find most comfortable, patient. So that way of thinking, that patient-centric and putting the patient at the center and getting the regulations out of the way is very important. Another one is, and I'll just end here with texting. One of the ways plans reached out to their members was through text messaging. That's the way America communicates today, text messaging. We don't use US mail. That's not the way we communicate. We don't even use email, but most plans across the country and systems struggle to text their members because of an old law, the Telephone Consumer Protection Act, passed in 1991. It is just ridiculous that we are in 2020 and about to hit 21. Everybody in America only communicates, their primary way of communicating is text message, and yet, Pam and her organization and other health plans across the country, they can't talk to their members in the way they want to communicate with them. So these are we've got to put the patient at the center, and in my view, make decisions and have policies that reflect a patient-centered approach. And if we do that, we'll have a lot more telemedicine and telehealth, and we'll be able to text people and a lot of other things that we aren't doing. And we won't need an emergency, a pandemic, 100-year pandemic to do it. That would be my suggestion.
Yeah. Well, I appreciate it. And I am excited. I'm honored to be part of this conversation because you guys are all super smart, and appreciate the humility that you bring to this conversation because we're all wading through this together. I want to end, I know we're kind of getting a little bit short on time. I want to end with a question to each of you, and I'll start with you first, Senator. But as we look ahead to the future of Arizona healthcare, and we think about what we're doing, what we're learning now, how we're going to deploy those lessons moving forward, 5 years from now, when we look back on this last period of time, what will it be in the healthcare sector or the health policy world in which we all live? Senator, what will it be that you will be most proud of when you look back 5 years from now, when you look back on this period over the next 5 years? What do you hope you will look back on this period and say, that is the thing I am most proud of?
Regulations. You have seen within the Ducey administration and backed up with legislation, the reduction in regulations. The last time that I had a count, which was probably 6 months ago, 900 regulations have gone away during Ducey's administration. And that was helped by a program, and was also helped by legislation that went through. And it also was helped by a bill that we passed. That time it was Senator Warren Peterson passed a bill taking down barriers, particularly, and it affected a lot of healthcare workers that were coming from other states who had to go through this, the reciprocity, which was horrendous, and one state wouldn't talk to the other state. In Arizona, we said, now, if you're licensed in Michigan, I bring up Michigan because we had a problem there. In fact, we just went around them and said, we're going to license them anyway. I think that's number one. I want to end just with a couple of words. I'm heartened when people say that the state should take a leadership position in certain areas and not the federal government. We're closer to you. You can get to us faster. We can react faster. You can teach us faster. You can unteach us faster. And that is the place that things move. When we wait for Washington to move, that's not so quick. The other thing that I hope that I can look back on, and I think this is important to this industry and many industries, is a bill that I've been working on, and that's a liability bill that would not make everybody hold harmless in the COVID-19 situation, but at least put some barriers in there so that we don't see just a mad rush of the street lawyers running to every industry and get into a sue and settle position. So those are the two. The final note that I would leave you on, as we move to more universal health care, just remember everything comes with a cost. And I know I'm talking to people that understand that. You've got to help the state, not the legislature. You've got to help the state find out more effective ways to raise revenue outside of taxes. Taxes will drive people away, as it is in New York, Illinois, and California. We've got to figure out how to do that, and so that we can ensure with the type of insurance and the type of healthcare that everybody wants. I'm one of them. I'm of the age where I want to be a 25-year-old. I'm not, but I want to keep going forever. So I thank you for this opportunity. I hope I've learned something. It was, and I hope the people looking in TV land or computer land did. Thank you for the invitation.
Well, I'm of the age that I want to be 25 also. Anne-Marie, how about you? When we look back 5 years from now, of what will you be most proud?
I think it's right where we are right now. And I hope that we, as a community, as Arizona has flattened the curve, that we have taken sort of aggressive measures today, tomorrow, the next couple of weeks, and that we avoid really crisis standards of care and a disaster in our community, and that we all take action, and that we, the Hospital Association and our other healthcare partners and health plans and hospitals have all sort of stood arm in arm with our community, and we can do this, and that we got it done, and that essentially we saved lives. That's what I hope happens.
Abner, 5 years from now, what are you going to be the proudest of?
I hope it will be that we rolled out a vaccine to the whole country in a way that didn't reinforce health inequities, but instead took those into account, and that we rolled it out in a way that people who needed it most and most at risk got it first, and that we didn't stop until every person got it, and that when we saw people unwilling to take it, we addressed that. We went about building trust so they would get it. So we can say that rollout was just an absolutely fabulous thing that ended this pandemic and ended it quickly.
Pam, we'll give you the last word. What will you be proudest of when you look back on this period in 5 years' time?
I think I'm hopeful. I am hopeful that Arizona will set the model for the nation around an integrated medical system where insurance and delivery are working together with the same objectives and goals, with the patient in the middle, and we're delivering affordable, simple, convenient healthcare to all of Arizonans.
Pam Cahaley, the CEO of Blue Cross Blue Shield of Arizona, Anne-Marie Alameddine, the CEO of ASHA, Arizona Hospital and Healthcare Association, Senator Vince Leach, the Vice Chair of the Senate Appropriations Committee, and Abner Mason, CEO of Consejo Sano.